I'm Nicole.
I'm Emily. We're your full hygienists, back again.
This time we're talking about floss. Flossing is one of those things that nothing ever cleans between your teeth. This is so important. It's something that people always skip because they think they've brushed and that's good enough. Flossing is almost more important than brushing because nothing cleans between your teeth. So you want to get yourself some decent floss. I don't know if you can see this. We want like a good 12 to 16 inches of floss. If I could get it cut. And then you're going to take your floss and you're going to wrap it around your middle finger, not your pointer finger. And then leave yourself some space in between your hands. What did you say that was?
7
inches, something like that. And then you're going to control it with your thumb and your forefinger to control what you're doing here. So what you want to do is you want to come in and get in between your teeth, nice and easy so you don't snap your gums. And then you want that floss to wrap like a C shape around that tooth. I don't know if you can see that. See if you can see? Like a C, really tight around that tooth, and then let that floss slide all the way down and underneath the gum line, which is pretty far under the gums, and pull that bacteria up and out. Flip it to the one next to it, same thing, pull it really tight into that C shape, all the way down under the gum line, up and out. It won't stay in there. Up and out. Those contacts are always tight. In the back, that's difficult, right? So same thing, give yourself some space between your hands, take your pointer fingers, and you're just gonna slide in and push backwards in the mouth, right? So you're just pushing with the tips of your fingers up and down on that gum line, pull it forward on that tooth in front of it, up and down and out. So it's just pushing and pulling against those back teeth. So if you feel like it's hard to get your hands in there and in the back of your mouth, just use those tips of your pointer fingers and just push and pull as you come through. Watch in the mirror, make sure you're getting that C shape going on.
Absolutely. Getting through the contact point is one thing. We don't just want to snap it in and out. You want to get in there, stay in that space, and then hug each side of the two teeth that you're working between. Some people have a hard time using the string floss with their two hands, and I will tell you it is better. And you get more proficient the more you do it. Practice makes perfect. So if you can force yourself to get in that habit and get in that routine, practice it. There's some patients of ours that just have dexterity issues. Kids sometimes have a challenging time. There's different floss aids out there. There's even water flossers, water pick. We can discuss that in another future video. But for now, basics. These floss aids, same thing. You want to get in between. You're going to kind of seesaw it in, and then you're going to kind of rub it on the surface of one side, and then get the surface of the other, creating that C shape with the floss. I don't even know if you guys can see that, but the floss is going to be kind of bent and bowed, so it creates the letter C.
Right.
And my main thing, as I'm telling my patients, is plaque is just constantly forming on your teeth. It's a community of bacteria. We talk about biofilm, but I just like simple terms. It's like creating a Lego tower. It's creating a community on your teeth. And you need to go in there and physically knock that Lego tower down. You need to remove that plaque.
Yes. I mean, they're even creating waterways in there. I mean, it's a pretty complex system, and you have to disrupt it so that their cities aren't so efficient.
Absolutely. And we talked about this real quick in our brushing video, disclosing tablets. You can get these again and check your work and see what line angles that you're missing and how much you actually have to rub and scrub those sides of the teeth where your toothbrush that you're thinking is getting is actually missing.
Right. Toothbrushes don't really wrap around corners, and if your floss is straight, it doesn't either. So you always got to think about getting around those corners.
And nighttime is always the best. If you're going to do the floss once a day, at least do it before bed. So, all right.
All right.
Thanks for joining us.
Thanks.